Good morning, everyone. Happy Monday. Thanks for joining us here at the SCV Birth Center. Hey, so today we're going to talk about delayed cord clamping. I posted something yesterday, which was Sunday, on Instagram and Facebook on us doing we had a little baby in there and the siblings were around and we were cutting the baby's cord. And we get lots of questions about when to cut the cord. Why do we wait so long to cut the cord? So I said to my husband today, I'm doing a Midwife Monday today. I'm doing it on delayed cord cutting. And he's like, what does that mean? Like, you wait until the kid's like 50 years old before you cut the cord? I think he said it a little bit funnier than that. But it was pretty funny. So, delayed cord clamping. So, I'm going to assume that most people listening to these Facebook Lives and listening to them on YouTube and all those other places where we post it, most of you guys are probably having babies born in the hospital, because really less than 1% of the population births out of hospital. So all midwives, as far as I know, under most circumstances, all delay cord clamping. Many of us wait, actually, way late to cut that cord. Here at the birth center, we actually don't even separate the baby from the placenta. We don't cut that cord till about the 2-hour mark. And it's not because the baby's getting any nutrients at that point. It's just we want to do less stimulation to the baby. So if you've seen some of the posts we've made, you see that the baby's laying down and you'll sometimes see the cord. And if you look closely, you'll see that we have the placenta. You can't see the placenta. It's in a bag. Because what we do, baby is born, put skin to skin, and this can happen in a hospital too. So I'm just going to talk a little bit about briefly what we do here out of hospital versus what's reasonable to expect in a hospital. Because what we do out of hospital is not reasonable in a hospital setting. It's not practical. There's no health benefit, really. It's cumbersome for the nurses. They're not equipped to really handle this organ sitting next to your baby's body for 2 hours. It's really not in their wheelhouse. And that's okay because it's not really necessary. So out of hospital, what we do, baby's born, immediately put skin to skin, and the cord is pulsing, right? That baby's getting all those red blood cells from the placenta. And the studies are varied on how long one should allow the cord to pulse. In an out-of-hospital setting, we allow the cord to pulse until it completely stops. Then there'll be a little bit of blood that comes from mom that tells us that the placenta is ready to be delivered. And then the placenta is spontaneously delivered anywhere from 5 minutes to 60 minutes after the birth. The placenta is delivered. Oh, I wanted to bring my little artificial placenta and cord to my thing today. I'll show a picture of it later. Anyway, cord's delivered, placenta's delivered, we put it in a bag, we sit it next to mom, nobody even really knows it's there, baby's attached, and now we have all this skin-to-skin time, and the placenta is just chilling in a bag. There's no nutrients coming from that placenta at that point. So in a hospital setting, we recommend that everyone has delayed cord cutting. It is recommended by ACOG, the American College of Obstetrics and Gynecology. They do acknowledge that delayed cord clamping is the standard of care, should be done, has multiple health benefits. And the World Health Organization agrees that cords should continue to pulse. The World Health Organization recommends that the cord pulses for 3 minutes. That's their recommendation. 3 minutes, is kind of a long time. It's ideal, baby born in the in-hospital setting, baby's born, put skin to skin on mom, 3 minutes to allow that cord to pulse and that baby to get all those extra red blood cells. And the point is, the benefits of that delayed cord clamping is that the baby's blood volume is increasing in those 3 to 5 minutes that you are in a hospital setting allowing that cord to pulse. The World Health Organization says 3 minutes. The Royal College of Midwifery in England says 3 to 5 minutes. ACOG, I think ACOG just says that there's no real timeline. There's no optimal time for delaying the cord clamping, but that we should allow it to pulse until it stops spontaneously. And generally that's, 3 to 5 minutes. So, and why do we do this thing, right? I read something that Charles Darwin said in 18 something, that a cord should never be cut, that it should continue to pulse until it spontaneously stops, and then at such a point, then it can be separated from the baby. And that was, way back historically, because we know that it increases the baby's blood volume, it helps stabilize the baby's blood pressure, it helps with liver function, which is really interesting. Because one of the concerns that people have with delayed cord clamping is this theory that it will increase the jaundice in the baby. That's the yellowing of the skin that we see generally after the 24-hour mark with a baby. Generally 24 hours to 5 days is when we see this increase in bilirubin. And so there are some theories not founded in the evidence, actually, that delayed cord clamping will elevate the baby's bilirubin to a pathological level, to a level that is too high. And actually that has not been supported in the research. And ACOG addresses that, actually, that there's no research that confirms that it will cause too high a level of jaundice. It says there is a small increase in the incidence of jaundice, but that what we also know is that with the delayed cord clamping, it helps liver function, which helps metabolize the bilirubin. And bilirubin, by the way, is an antioxidant. So bilirubin is important. It plays a role in a healthy newborn baby. But we know that it does not cause pathologically high levels of jaundice. It does not cause our babies to be under the billy lights. And we do this on every single one of our babies born here, and we do not have babies needing phototherapy for high bilirubin. You can still, those sometimes in the hospital and out of hospital, some people want to bank the baby's cord blood, right? Stem cell cord blood banking. That is a little bit complicated if you're doing delayed cord clamping. Obviously, all those red blood cells are going into the baby, so you're going to have less that you can harvest to bank for a future date. We recommend that you just allow that baby to get all those red blood cells directly versus banking those cord blood cells. If you're having a cesarean section, you can do a somewhat delayed cord clamping, not 3 to 5 minutes. It's not appropriate, but there is, a minute or so that is appropriate that you can delay it. In a normal cesarean, it's immediate cord clamping is what's generally used, but there can be a bit of cord clamping, a bit of delayed, and maybe even a bit of milking. That's when you push. You hold the cord and you push the blood as if you're trying to push it quickly into the baby's body. That should not be done normally, but sometimes that's done with a cesarean. What we do know is that by delayed cord clamping, we're preventing iron deficiency during that baby's first year of life. That's really important. We want that baby to get all those iron-rich blood cells, and we know that it greatly reduces the incidence of iron deficiency. It allows for healthy liver function, lung function, kidney function. Delaying that cord, it's really important. It increases the baby's blood platelet levels. That's really important for clotting, right? So we have babies that are born, we immediately clamp and cut the cord, and then we give babies a vitamin K shot for blood clotting, right? In the event they have a disease called vitamin K deficiency, where we know if we let this cord delay and let it pulse until it's finished pulsing, that baby's blood clotting, those platelets are higher, less likely to need blood clotting factors after it's born. So the body works really well if we leave it alone, right? It increases the number of stem cells, which help repair potential brain damage. There's lots of really important things that we know that stem cells do. I already said it stabilizes the baby's blood pressure. It helps with growth and development of the brain and the central nervous system, right? Because of the increased iron, the increased stem cells, this helps the baby have a healthier functioning brain and central nervous system. Really important. And increases the baby's blood volume. Does not cause an increased risk of maternal hemorrhage. We can still, if mom is bleeding after the baby's born, we can still administer antihemorrhagics. It does not affect that. There should be no effect to the mother. There's nothing special to do, just baby's born, put skin to skin on mom, leave mom and baby alone, right? And then 3 to 5 minutes is ideal in an in-hospital setting. And if doctors are your care provider, if it's a doctor or a nurse midwife in the hospital, or another provider that is not familiar with delayed cord blood banking and are concerned about doing such a thing for some old school thought on it, you can go to ACOG, A-C-O-G, and look up their position paper on the recommended delayed umbilical cord clamping for all healthy infants. And it was published December 21, 2016. So 1 year ago, ACOG, their position is delay that cord clamping. We know it's in baby's best interest. So I encourage those of you that are having a hospital birth to talk about it with your care provider, present some evidence if there's any pushback on it, request a certain amount of minutes so that it's clear how you want to proceed with your baby. You get to have a voice in that. Of course, if there are emergency situations in a hospital setting, they're going to clamp and cut the cord and bring the baby over to the warmer and do what's appropriate to make sure that your baby is breathing and doing all the appropriate things it's supposed to do as soon as it's born. Here at the birth center, what we do is we always, any emergency procedures that have to be done, if we have to breathe for your baby or chest compressions or anything severe like that, we do it bedside without cutting the cord, because we want to give this baby as much advantage as it has in case there's an emergency, that there's continued blood flow to this baby. So if we have to do a resuscitation, we do that with the cord still attached to the baby. We are not, in our situation, we don't have to put the baby in a separate location far away from mom. We can do that right at the bedside, right on mom or right next to mom, where we don't have to cut the cord. And delaying the cord blood there are no downsides to doing such a thing, right? There's no evidence that supports that it has any detrimental effects to the bilirubin. Blood flow is not going to reverse. That's some theory that's been thrown out there, that if you have to hold the baby below mom in order for the blood to continue to flow into the baby. That is not a thing. That is not true. Baby can be above mom, like on mom's chest. It doesn't have to be below her. Blood doesn't reverse direction. So baby can be skin to skin while the cord is pulsing. The provider does not have to be holding the baby below the perineum in order for the baby to get all of its blood flow. That's been talked about, and that is not a real thing. So baby can be born, handed to mom, skin to skin on mom's chest, let that cord pulse. There's nothing that has to be done at this point. We don't need to weigh a baby at this point. The baby's heart rate can be assessed on top of mom. Respirations can be assessed on top of mom. Baby's color is assessed on top of mom. The APGARs, right, that 1 minute and 5 minute assessment is all done on mom. There's no reason to immediately clamp and cut this cord and bring the baby to a warmer unless this baby needs efforts in breathing, right? Somebody needs to intervene and breathe for your baby. Then generally there's no reason to separate mom and baby. We know babies stabilize better when they're skin to skin on mom. Their body temperature stabilizes, their blood pressure stabilizes, their respiration stabilize. We want that baby in the habitat. That's what we call it. We want that baby in the habitat immediately at birth. And of course that is what we do here in an out of hospital birth setting. And then when we do the newborn exam about the 2-hour mark, those are some of the photos we post on Instagram and videos that we post. You'll see that the baby is fairly calm. The picture we posted yesterday, the video, the baby wasn't super happy. Really stimulated. There were a lot of siblings around. So we quickly help the kids, the older siblings, cut the cord and then get that baby right back to mom within like 45 seconds of cutting that cord to stabilize the baby, get the baby a little bit calmer. So that's my 2 cents on delayed cord clamping. I think all babies should have it. ACOG agrees. American College of Obstetrics and Gynecology, they agree. Look at their position paper. Up to Date, which is a database that we subscribe to, that we get all of our current medical research in, agrees that delayed cord cutting is the way to go. The World Health Organization says delayed cord clamping is the way to go. The Royal College of Midwifery agrees that delayed cord clamping is the way to go. American College of Nurse Midwives agrees that delayed cord clamping is the way to go. All of us hippie midwives agree that delayed cord clamping is the way to go. So do that for your baby. Give your baby the gift of all those red blood cells. Give your baby that gift of the blood that it deserves. Any questions or concerns on that, feel free to give us a call. Follow us on Instagram. Like us on Instagram. Comment. Like us on Facebook. Check us out on YouTube. And all those fantastic things. We'd love to hear about you guys. We'd love to hear what questions you have. We have an exciting thing we're going to start in the new year. We're going to do a once a month series, and we'll give you more information on that coming up. Have a fantastic holiday season. Be good to yourselves. Be kind to people in the stores. Try not to lose your temper. Everybody is really heightened. There are a lot of people out there. The line at Michael's supply art place yesterday was from the register all the way snaking to the back of the store. I don't know what everybody needed in that store yesterday, but be patient, be kind to your neighbors, and treat yourself right. Eat well, drink enough water, get some rest. You don't need to be buying everything in the universe. You all probably have everything that you need. So just remember to be thankful this season and be kind to your neighbors. Okay, have a great day, guys. Thanks.